Hi everyone, a blessed day to all. Praying that all of you are safe and doing well together with your families and loved ones. I'm also praying that you are able to cope with your online learning. So this week we have two topics to discuss. This is actually a continuation of our physical examination. So this is done after doing the general survey, after getting the vital signs of the client and doing assessment of pain. Okay, so it is now time for us to examine the integumentary system, which is the very first system that you will perform physical examination. Again, after your general survey. All right. So after the integumentary system, we will proceed to the next topic, which is the head. Okay. Before proceeding to the main topics for this week, let me present to you this slide first, the disclaimer slide. All right. Okay, moving on to physical examination. Okay, on the integumentary system. Can you think of or recall what you have learned about integumentary system during your anatomy and physiology class in the previous semester? Okay, so ano ang natatandaan about integumentary system? Alright, so your integumentary system is your skin. And according to our reference, the skin is the largest and the heaviest organ of the body. Approximately 16% of the human body weight contains your integumentary system or your skin. The intact and functioning of the skin is essential for the life and the health of the patient. Therefore, correct nursing assessment or examination on the skin is essential because the examination of the skin can reveal signs of systemic diseases like psoriasis and etc. If there is a medication side effects like allergies, signs of dehydration or overhydration, signs of physical abuse. Okay, so examination of the skin also allow us to early identify potential cancerous lesions and the risk factors for pressure ulcer formation, particularly for the elderly or for the patient who are unconscious or immobile. And it will also help us identify the need for hygiene and the need for health promotion education or health teaching to our client. This will guide us to design our nursing care plan for an effective patient care. Not only effective, but quality patient care. Okay, those are the learning objectives of this presentation. At the end of my presentation, the students will be able to identify structures of the skin, the nails, and hair. Will be able to obtain an accurate history of the integumentary system and correctly perform an integumentary system examination using the two cardinal techniques of physical examination. Then identify the skin, hair, and nail problems and discuss health education and promotion strategies to reduce the risk for cancer. Okay, before proceeding to physical examination, let us first review the anatomy and physiology of the integumentary system. So, our skin keeps our body in homeostasis and it has so many functions. Okay, so you will really appreciate how great our Creator is when you study anatomy and physiology of the human body. So our skin provides a barrier that protects our body from injury secondary to mechanical, chemical, thermal, and ultraviolet light sources. It also protects our body from invasion of microorganisms, and it protects or prevents us from dehydration. It also helps in the regulation of the body temperature by allowing heat dissipation through the sweat glands and the heat storage through the subcutaneous insulation. Also, our skin helps in synthesizing vitamin D. So, the vitamin D naman helps calcium absorption, immune function. It protects our bone, muscle, and heart function or heart health. Also, the skin helps in sensory or allows in sensory perception via the end sensory organ, wherein we can feel touch, pain, temperature, and pressure. Just imagine, no, if you cannot feel touch, baka nasaksa ka na, nasugatan ka na, hindi mo pa rin na-feel without the sensory organ. It provides non-verbal communication such as posture, facial movements, vasomotor responses such as blushing, di ba? Kapag kinakabahan ka or bigla kang naging masaya dahil nung Valentine's, biglang nagbigay sa'yo ang crush mo ng flowers or gift, di ba? Biglang tumaas ang iyong heart rate. Okay, yung blood mo pumunta agad dyan sa iyong face so nagkaroon ka ng blush. Okay, so it provides identity through the skin color. Diba? We can say that you are Asian, African, American. Allows wound repair, okay, through cell replacement on the surface of injuries. Yan. Allow excretion of metabolic waste such as electrolytes, minerals, sugar, or uric acid. Okay, continuing with the anatomy and physiology of the skin. So the skin has 3 layers. You have the epidermis, which is the outermost superficial layer. Okay, and it is divided into 2 layers. The horny layer, which is the outermost layer of the epidermis, and the innermost layer of the epidermis, the cellular layer. This is where the keratin and melanin was formed. Okay, and the next layer is the dermis that contains the sebaceous gland, the muscle that erect, no, hair shaft. Okay, it also contains the sweat glands and the hair follicles. And the third layer is the subcutaneous or the adipose tissue, wherein you can find the vein, the nerve, and the artery. Alright, so continuing with the layers of the skin, again, you have the epidermis, which is the most superficial. It is thin and no blood vessels. Okay, it depends only for its nutrition on the dermis. Okay, because the dermis, or the second layer of the skin, has blood vessels. It has connective tissue, sebaceous gland, sweat glands, and the hair follicles. And the third layer, again, is the subcutaneous or the adipose tissue that connects to the underlying structures such as the fascia, the muscle, and the bone. Okay, so the color of the healthy skin depends on the 4 pigments: the melanin, the carotene, the oxyhemoglobin, and the deoxyhemoglobin. So the melanin is the brownish pigment of the skin that is genetically determined, meaning depende sa genes or sa race. Okay, and is increased with sun exposure. The carotene is the golden yellow pigment that exists in the subcutaneous fat and in the heavily keratinized areas such as the palms and the soles. Okay, another pigment of the skin, the oxyhemoglobin. So from the word hemoglobin, your hemoglobin carries your hemoglobin which circulates in the cells that carries most of the oxygen in the blood. Okay, so it exists in two forms, the oxyhemoglobin and the deoxyhemoglobin. The oxyhemoglobin is a bright red pigment that predominates in the arteries and capillaries. So an increase in blood flow through the arteries to the capillaries can cause the reddening of the skin, such as in blushing. Diba? Pag nag-blush ka dahil kinabahan ka or nasampal ka dahil nakitaan ka na may another girlfriend, okay? And then sinampal ka ng girlfriend mo. Okay? And another one is the deoxyhemoglobin. Okay? As the blood passes through the capillary bed, oxyhemoglobin loses its oxygen to the tissues and changes to deoxyhemoglobin. It is a darker and somewhat bluer pigment. So the increased concentration of deoxyhemoglobin in the cutaneous blood vessels can give the skin a bluish color or known as cyanosis. So there are two types of cyanosis, okay? If the oxygen level in the arterial blood is low, the cyanosis is what we call the central, and it indicates decreased oxygenation in the patient. While if the oxygen level is normal, cyanosis is peripheral. So moving on to the abnormal color of the skin, we have what we call jaundice or the yellowish discoloration of the skin. This is due to deposition of bilirubin or biles, and it is easier observed in the sclera, okay, sa whitish ng iyong eye, the nails, the palms, and the sole. Okay. Do not be confused with patient who has darker complexion, okay? Normal na sa kanila na medyo yellowish ang kanilang sclera. So you have to double check for that. Okay. But to check if there is jaundice, you might need to check the palms and the soles or the nails. Okay, another abnormal color is what we call the cyanosis. As mentioned in the previous slides, it is the bluish color. Okay, again, if the cause is lack of oxygen, okay, this is what we call central cyanosis. But if the cause is lack of blood flow to specific areas of the body, we call it peripheral cyanosis. Okay, so moving on to the appendages of the skin, we have the hair. So look at the picture. Okay, there are two types, hair, the vellus and the terminal. So the vellus hair, usually, itong hair na to is nakikita during pre-pubertal stage. It is short, fine, inconspicuous, it is unpigmented or very light in color. So napansin nyo, very thin siya compared to the terminal hair, which is coarser, thicker, conspicuous, usually pigmented or darker in color. So an example of your terminal hair are the scalp hair and the eyebrows hair. Okay, continuing with the appendages of the skin, we have the nail. Okay, so these are the parts of the nail. And the purpose of the nail is to protect the distal ends of the fingers and toes. Okay, so it has the proximal nail fold. So look at this view, no, and the cross section of the nail plate. So under your proximal nail fold is the nail root. Therefore, the proximal nail fold covers your nail root. Okay, and we have the cuticle. The cuticle serves as the seal. that protects the nail fold or the proximal nail fold and the nail plate from moisture. Okay. We have the lunula, which is the whitish in color, and the nail plate. Okay, so we have the nail plate. So under the nail plate is the nail bed, where uh, it is the one who give the color of the nail plate. Kung bakit nagiging red tingnan or pinkish yung ating nail plate. It has the lateral nail fold that again protect the lateral sides of the nail plate. At ito naman yung free edge. Ito yung usual na ginugupit natin because it harbor microorganisms. Okay, so after your nail, we have the glands. We have the sebaceous glands and the sweat glands. The sebaceous glands is responsible in producing sebum, in lubricating the hair and the skin, and it helps in reducing water loss through the skin. While the sweat glands, it has two types, the eccrine and the apocrine. The eccrine is widely distributed, open directly on surface, and it helps control the body temperature, while the apocrine is usually found in the axillary and genital areas. This is usually stimulated by emotional stress. Di ba? Pag kinakabahan ka, pinagpapawisan yung mga areas na yan. And that is responsible for adult body odor. Okay, so before proceeding to the physical examination, ang tagal naman pala, no? Ang dami pang process bago talaga yung physical examination. You have to take the health history of the patient. The purpose of this is to identify the following. The diseases of the skin, kung may previous na disease si patient or recently, systemic diseases that have skin manifestation such as those you can observe from patient with psoriasis, okay, or patient with diabetes, no? Diba nakikita natin yung mga non-healing wound, okay, sa kanilang skin, particularly on the foot or on the toes. Is there a sign of physical abuse? Okay, the risk for pressure ulcer formation, again, particularly for the immobile or unconscious patient, the risk for skin cancer, and to identify the need for health promotion, education regarding the skin. Okay. So those are the common or concerning symptoms. Habang ginagawa mo yung health history, if you found rashes, that can be a sign of allergy, no? You have to check the characteristics. The non-healing lesions, the moles, growths like cyst, okay? Lesions, the characteristics, okay, the bruising or ecchymosis. What are the causes? Bakit nagkaroon? Is the patient anemia or may problem with the blood, red blood cells? Hair loss like alopecia. Is there nail changes? Okay. So if you found these symptoms, you need to explore. Okay, you need to explore on these symptoms. Okay, so moving on to the health history. For the past history, you have to check or assess for the skin diseases. You may ask the client, do you have any skin diseases such as melanoma, eczema, psoriasis, etc. Of course, when you ask those questions, remember to pose per disease. Okay? Do you have diabetes or peripheral vascular disease? Do you have allergies to medication or food sensitivities or allergies to a particular product? Do you experience burns or sunburn? Okay, is it first degree burn, second degree burn? Do you use corticosteroids medication for more than 2 weeks? What medication did you use to relieve the symptoms? Okay. what type of immunization you had in the past. Ayan. Okay, for the family history, you will ask your client, is there any member of the family uh, experience the same or similar symptoms? Okay. Does any member of the family have skin diseases like melanoma, eczema, psoriasis, etc.? Is there any member of the family who have allergies to food, to medication, or to a particular product? Okay. And then you have to assess also the lifestyle and the personal habits of your patient. Ask your patient about the bathing and shampooing routines. Tuwing kailan ba naliligo? Nagsha-shampoo ba or not? Did the patient change product recently? Okay, do you wear false nails or wigs? Do you go to nail salon or gym? Are you exposed to sun? Usually in what time? How long? Okay, ilang oras? Do you do skin self-examination? Are you exposed to chemicals or radiation? What is your particular diet, daily diet? Ayan. Alright, so finally, we are now doing the physical examination of the skin. Make sure to use natural or artificial light that resembles natural light. Ensure that the patient is properly draped, that is to provide privacy and for the comfort of your patient. And the cardinal techniques that you will use in physical examination of the skin is inspection and palpation. Of course, you will not use percussion and auscultation. Okay? So, first, assess the color of the skin. Look for increased pigmentation. Okay, look at if the color of the skin is uniform. Okay, the exposed area, is it darker compared to the unexposed area? Is there loss of pigmentation that might be a sign of vitiligo? Or is there redness of the skin or erythema? Okay, assess for cyanosis or the bluish color of the skin could be a sign of decreased oxygen level or blood flow on that area. Is there pallor or pale? Assess for jaundice, again, the yellowish discoloration of the skin. Okay, so moving on to our physical examination of the skin. These are the example of the abnormality of the skin color. The cyanosis, you can observe here the fingers, okay, and the toes. The cyanosis is best observed in the horny layer of the epidermis, which is the thinnest layer of the skin, like the fingernails, the lips, the mucous membrane, okay, such as in the mouth, and palpebral conjunctiva. For the dark-skinned people, it can be observed on the palm and on the soles. Okay, so look at this. Okay, you have to compare the picture. This is the fingers. Okay, look at the nails. It is pinkish in color, which is the normal color of the fingernails. And the two nails, look at the color. It is bluish, no? This is what we call cyanosis. Again, there are two types of cyanosis, the peripheral and the central cyanosis. The central cyanosis is most observed in the lips, in the oral mucosa, and the tongue. This can be observed with a patient who has advanced lung disease, congenital heart disease, and etc. Okay? And another example here is the erythema. Okay? This is a type of skin rash that is caused by injury or inflammation of the blood capillaries. Okay. So another abnormal color of the skin is the carotenemia. Okay. So carotenemia is a yellowish color of the palms, no, it does not affect the sclera. Yun yung pinagkaiba nila sa jaundice. The cause of this carotenemia is because of diet high in carrots and yellow vegetables. For the jaundice, it refers to the skin diffusely yellow that can be observed in the sclera and the mucous membrane. Okay? So, yung may mga jaundice or jaundice skin, this can be observed with the patient who has problem in the liver or liver cirrhosis or those who have hepatitis. Yan, nagkakaroon ng jaundice or yellowish of the skin. Okay, so another abnormal color of the skin is the cafe au lait spot. Okay, those are a type of birthmark that is characterized by a flat patches on the skin. They are light brown, okay, in color that can be darkened with sun exposure. It has somewhat irregular border, no, pero this is benign. So another is the acanthosis nigricans. Okay, this is the velvety discoloration in body folds and creases such as the armpits, the groins, and the neck. This is associated with obesity and those patients with diabetes. Sometimes nakikita rito sa mga buntis, lalo na kapag tumataba na yung buntis on the 3rd trimester. Okay, so another one is vitiligo. Okay, there is a depigmented macules appear on the face, on the hands, on the feet, okay, and other regions. This is hereditary. So another one is tinea versicolor. Okay, it is a common superficial fungal infection of the skin that causes hypopigmented areas. It is slightly scaly macules on the trunk, the neck, and the upper arms. So moving on to our physical examination of the skin. After checking the color of the skin, it is now time for us to check the moisture. Okay, to check if there is, okay, by looking at the skin of the client by inspection. Okay, is there excessive dryness, okay, sweating, or oiliness? Kung masyadong dry yan, probably a sign of dehydration. Pinagpapawisan, probably stress yung client or may emotional stress, etc. The skin should be dry to touch without flaking or cracking. Kasi kapag nag-flake yan or nag-crack yan, meaning that is dehydrated. And then carefully inspect the skin folds as well. Okay, so aside from moisture, we need to check the temperature as well of the skin. Okay, hindi lang agad-agad thermometer yung gagamitin natin to check for the temperature of the skin. You can use the back of your hand, which is the most sensitive part of your hand. No? Pag nilagay mo yan, sensitive yan to temperature. And note for the generalized warmth or coolness, kung masyadong mainit or malamig si patient, baka may hyperthermia na or hypothermia si client, generalized. Note an increased temperature with erythema, particularly on a particular area. Okay, baka may redness dyan, medyo mainit-init yung area, maybe there is that is a sign of inflammation. Okay, so it is also important for us to check the texture. Okay, is it rough or smooth? Okay, check for mobility and the turgor. Okay, you have to lift fold of the skin. Okay, ease with which it lifts. Okay, that is for mobility. No, pag inaano mo, hinahawakan mo. Okay, speed with which it returns into place. For the skin turgor, you can do it on the forearm. Okay, so ganyan mo, bumabalik ka agad siya. Okay, if hindi agad yan babalik, kapag poor ang skin turgor, that could be again a sign of dehydration. Okay, so you can perform skin turgor on the skin under your clavicle as well, or under the clavicle of your client. Okay, also check for edema. Okay, edema refers to the excess fluid in the interstitial spaces. Okay, there are types of edema, localized. Okay, the cause of this edema is injury. Okay, di ba kapag may na-injure yung isang area or may nabalian na buto dyan sa area na yan, so namamaga. So, pamamaga, that's the Tagalog of edema. If the cause is systemic, probably it can be seen on the dependent portions of the body. Okay? Kapag may problem sa heart, okay, nagkakaroon ng edema. Okay. Skin puffy and it feels tight. Okay. If the edema is pitting, there is an interstitial fluid mobile or fluid sheet between the tissues. Okay? The non-pitting edema, the cause is usually local infection or trauma, or this can be called as Browning edema. Okay, so you can see here the example, no? This is the normal, okay, normal skin. Okay, ito yung may edema na mamagana siya. Pitting edema when you press your fingers on that area, so makikita mo yun, nagmamar. So this is how you will check pitting edema scale. Okay, 1 positive kapag yung depression is 2 mm, 2 positive or 2 plus kapag 4 mm, 3 plus kapag 6 mm yung depression, 4 plus kapag 8 mm yung depression. Okay, so let us proceed to the physical examination of the skin pa din tayo, of course. Okay, you have to check for the presence of lesions. May lesions ka bang nakita? What is the color of the lesions? Okay, is it red, brown? What is the size? I-measure natin yan by millimeter or cm. Is it elevated? Number, how many? What is the texture? Is it rough or smooth? Okay, what is the type of skin lesions? What is the shape and the pattern? Okay, what is the anatomic location and distribution? Saan mo ba nakikitang nag-start? Is it from the head or is it from the trunks? Okay. So an example of skin lesions, okay, we have what we call tethyriasis rosea. It is relatively common skin condition that cause a temporary rash of raised red scaly patches on the body. This can affect anyone, okay? But it's common daw among children and young adults. So another example of skin lesions is the psoriasis, which is a skin disease that causes red, itchy, scaly patches, no? Most commonly found on the knees, the elbows, the trunk, and the scalp. This is common and a long-term. Chronic daw ito na disease with no cure. Pwede lang siyang mag-subside in few weeks or months, but babalik din ulit. Okay. Another example of skin lesions is the tinea versicolor. The cause of this is fungal infection of the skin. Okay? Kaya nagkaroon ng pigmentation of the skin that results in a small discolored patches. Yung patches daw niya may be darker or lighter in color, okay, and commonly affect the trunk and the shoulder. So atopic eczema, okay, or dermatitis. Atopic dermatitis is a condition that makes the skin red and itchy. This is common in children, but again can occur at any age. This is also chronic or long-lasting, no? So let us now move on to the patterns and shapes. May mga patterns and shapes yung skin lesions. For example, here, the linear lesions that appears in a straight line. Okay, yan, straight line. Example, nakikita natin itong linear lesion sa itong nakikita nyo sa picture. This is an example of epidermal nevus. And another is the geographic, parang mapa ba? wherein the areas of one color with ito may white, may red, with variably scallop borders that interface, patong-patong sila with one another. So this picture is an example of mycosis fungoids. So clustered. Okay, yung clustered naman, lesions are, as you can observe in the picture, it is in group, diba? Isang group sila, okay? This picture is an example of herpes simplex. And another example of the pattern and shapes of the skin lesions is the serpiginous, from the word serpiginous. So, para siyang serpentine, yung kanyang mga borders. Okay? So, yung lesions appear to creep from one part to another. Yan. Dugtong-dugtong sila. This example is an example of tinea corporis disease or skin disease. Okay, so another one is the annular arciform. Okay, the annular arciform. So, meron siyang reddish border. Yan, no? Tapos scaly daw yung nasa center niya. This is also itchy. Alright, so moving on to the presence of the skin lesions or the lesion, you have to check again if it is just single, is it multiple, ilan, what is the size, saang area, what is the shape, is it in clustered, okay, ano pa, naka-serpentine ba, okay, flat, elevated, palpable, non-palpable ba siya, okay, so moving on to the primary skin lesions or the initial presentation. Okay. We have the flat or non-palpable lesions with changes in skin color. For example, in the hemangioma, okay, this is an example of a birthmark, okay, that is present usually at birth. Okay. And vitiligo. Okay, so na-mention na natin kanina yung vitiligo, no, nagiging white yung portion of the skin. And another example of the non-palpable lesions is the lait spot, which was mentioned again in the previous slides. And meron naman tayong example for the palpable elevation. Okay, kung kanina non-palpable, meron din tayong palpable lesions, the solid masses, no? Example ng mga lesions na yan ay katulad ng nasa picture, which is an example of the psoriasis. Diba? Nakita nyo, it's elevated, it is scaly, so ramdam na ramdam mo yan pag hinahawakan mo siya. Okay? And another example is the papule. The papule is less than 1.0 cm. Example din, nakikita yung papule sa may mga psoriasis din, lalo na pag nag-start pa lang. And another example is the nodule. It is marble-like lesion that is larger than 0.5 cm. That is often deeper and firmer than a papule. So this example is a dermatofibroma. Okay, the cyst. Okay. So this picture shows an example of epidermal inclusion cyst. The cyst is a nodule that is filled with expressible material that could either be liquid or semi-liquid. And the other one is the wheal. It is somewhat irregular, no? Kita mo, irregular, often reddish or deeper brown on the patients with dark complexion. So this can be seen in the patient with urticaria. So urticaria is an example of allergic reaction of the skin kapag may allergy. Okay, so another example of palpable elevations with fluid-filled cavities naman. No? We have what we call the vesicles, okay, with fluid-filled cavities. That is less than 1.0 cm. It is filled with serous fluid. Okay, example is the herpes simplex. And another example of palpable elevation with fluid-filled cavities is the bulla. Okay. The bulla, okay, Yung example dito sa baba is the insect bite. This can be 1 cm or larger. Again, this is filled with serous fluids. Okay, another one is the pustule that can be observed with the patient with acne, lalo na sa mga teenagers natin. Okay, so pustule is filled with pus. It can also be observed to those who have smallpox. Siyempre, hindi na natin naabutan yung smallpox. This is actually a contagious and disfiguring and often deadly disease that has affected the human for thousands of years. Naging epidemic din siya before. And it was, thank you for the help of the vaccines, no? It was eradicated, totally eradicated in the year 1980. Okay, to continue with the primary skin lesions, we have the burrow. The burrow is a minute, so maliliit lang siya, slightly raised tunnel in the epidermis that can be commonly found in the finger web and on the sides of the fingers. Example is the scabies. Okay, so ulit-ulitin natin that when you assess the lesion, you have to check kung single or multiple, the size, the shape and pattern, the color, the area. Is it flat? Okay, if it is elevated, you check if it is papule, nodule, cyst, wheal, bulla, or pustule. Thank you everyone. This is the end of my first presentation or the first part of the physical examination on integumentary system. Please watch the other video for the continuation of the physical examination on the integumentary system. Thank you. God bless everyone. This is the reference of this presentation.